Board-certified facial plastic surgeon Kevin Sadati is here with us. Welcome, Dr. Sadati.
Thank you.
And our job as plastic surgeons is to help people that have deforming issues with both their face and their body that affect their self-image. Clearly, this case was an extreme case.
Well, her case is very interesting because this kind of condition happens in older men, that they have rosacea and gets larger. So seeing such a wonderful lady having disfiguring and that affects her life psychologically, she was telling me that she works with kids in a swimming pool and parents thought it was contagious. So they were retracting their kids from her swimming classes. Parents were scared. And that really compelled me to help this young lady.
And let's help people understand what Sarah was suffering from, Dr. Orden.
Would love to. So what Sarah was suffering from was a condition called Rhinophyma. And what that is just an extreme form of rosacea, also called acne rosacea. And, you know, probably who's the most famous rhinophymatous person in the world was W.C. Fields. He had that classic rhinophymatous nose. And what is it? Well, it's a process where the sebaceous glands that we normally have in our nose just overgrow to the point where the nose becomes nodular and extremely large, as you can see in this picture and in the case of Sarah. Now, it being said that it is related to acne in some ways, there are medical treatments that you can try similar to treating acne. But in Sarah's case,
once you're at this point,
once it's this big, you're not going to get rid of it. So what Dr. Sadati came in, he first debulked this huge tumor using his scalpel to get it down to a much smaller shape, and then fine-tuned it, gave it gave her nose back using what we call a dermabrader. Some people also use a laser, and ultimately, this is what can be done for these type of patients.
You look amazing.
Thank you.
You look amazing.
Can I get a hug?
Yes, of course.
Wow.
And, look into camera 4 for us, if you can see that for Sarah, and they're going to put up a before and after. There you go, a live shot. And we also have a still shot in profile just to show.
Yeah. I mean, it's incredible. I can't.
I know.
It's crazy to think of how I used to look and how I look now, and I can't thank him enough. I mean, he has been a blessing, and
You can go give him a hug.
Woo! Dr. Sadati, a great result. Now, clearly, in Sarah's case, you can have a seat, so that it's not going to grow back anywhere near to the extent that she had. But
No, yet we have to control it. I have to see her in my office, make sure she's getting proper medications. And maybe in the future, I do a little laser resurfacing to maintain it and keep it healthy.
well, it's an excellent result. And
Can I ask the two of you, at what point should someone who's suffering from Rhinophyma start thinking about actually having a surgery?
that's such a great question, because as I said, it's sort of a continuum. It starts with rosacea, acne rosacea. It's when you start to see it getting nodular and that it's raised,
Thick, bumpy.
thick, bumpy, and you've lost the normal contours and anatomy of your nose. That's when you would seek out help.
Well, Dr. Sadati, amazing work.
Well, thank you so much.